Okay, well, I think that's fair enough. An extra couple minutes for those of you that are here again on time. I don't want to keep you waiting all day and listening to Medicare stuff all Saturday. So thank you so much for coming. Of course, if anybody trickles in, they'll catch up. My name is Kevin Chaikin, and I'm with Medicare Portal. Today, we'll be talking about Medicare and working past 65. Okay. Oops, I'm going a little too fast for my own good here, aren't I? Apologies. Well, that was the plan, at least. We'll see how it goes. So anyway, we'll talk about working past 65. If you ever need to contact me, my contact information will be here at the beginning as well as near the end. And ultimately, we want to make sure we help you get educated on Medicare, any and all things Medicare. So today, of course, we are focusing on this one specific topic. If it applies to you, then it is something you should certainly pay attention to. That's probably why you're here, or you can share this with somebody else who may be in the same situation. So first of all, who is Medicare Portal? So ultimately, we are an insurance agency. We're an independent insurance agency. We provide no-cost education and preparation for Medicare transitions, enrollment into Medicare, and on the insurance side, as well as lifetime support to current and future Medicare beneficiaries. Now, we are local for those of you that are in the Washington, D.C. metro area. However, we are also national in the sense that we are licensed in the majority of states. I personally am in about 23 states, and that is always growing. So we are expanding our footprint to be able to help Americans across the country. Medicare is a federal program with federal rules. So there are some different nuances from state to state, but in general, the program remains the same across state lines. We are a no-cost service, by the way. So any advice that you get from us, anytime you reach out, you're never going to receive a bill or need to ask, what is this going to cost me? What we do from an educational standpoint and to help guide you is all part of our service, as we're compensated ultimately by the insurance companies. So that, we're able to help you find supplemental coverage or prescription coverage or a Medicare Advantage plan that suits your needs, that you decide it makes the most sense for you. Those companies and plans will actually be the ones that compensate us. You won't pay anything extra for going through us. So you're able to use our services as an independent broker to look at all options versus going directly to one company who only offers, their products. And again, I would say we are unbiased. We are objective and independent in this, right? So, we have the ability to look at all companies out here so we can find you the right solution and the plan that fits you, not make you fit a plan that doesn't really suit your needs. So what are we going to cover today? As I mentioned, we're not going to try to keep you here all day. My goal is to have you off of here in about 15 minutes. Please note that if you have any questions, you can throw them in the chat or the Q&A function here with Zoom. Be happy to answer them. If I notice it during the presentation, I may stop. Otherwise, I'll certainly get to all of them at the end. So please do ask questions. There are no dumb questions when it comes to Medicare. As cliche as that sounds, it really is the truth, because this is a confusing topic, to say the least. So we're just cover briefly what is Medicare and whether or not you're eligible. What do you need to think about when you're working past 65? What are the decisions you have to make? When can you enroll, and when do you enroll? Medicare and HSA. So if you're contributing to a health savings account while you're still working, and how does that work with Medicare? And then ultimately Medicare with COBRA. Some of you may either be or may in the future wind up on COBRA as an extension of your employer coverage, which doesn't have the same rules, doesn't work the same way as just being on regular employer coverage. So we will go ahead and cover that as well. All right, so what is Medicare? All right, this is kind of an easy one for those of you that have been doing your research, but we got to make sure we know what it is. So we'll start at the 101 level here. And like I said, it's a federal health insurance program, and it's primarily for people who are 65 or older. There are certain people under 65 with certain disabilities that will qualify for Medicare as well, and those who have end-stage renal disease, kidney failure, or ALS, which is otherwise known as Lou Gehrig's disease. So, but for the majority of you, it's going to be those who are 65 or older, and you're, again, approaching retirement. So the different parts of Medicare, there are 4 parts, A, B, C, and D, and we'll cover briefly what each of those are. So we start talking about the alphabet soup of Medicare. It really is an alphabet soup. And this isn't even all of it. When we get into Medigap plans, there are even different and more letters associated with these plans. So it's confusing. Like I said earlier, probably could have found a better way to identify some of these, but this is what we've got. So Medicare Part A is your inpatient coverage. Okay, so this is going to be hospitalization, rehab, skilled nursing facilities, your home health care, hospice. Those are covered under Medicare. And what does this cost you? So most people are going to be paying zero for this. Okay, if you've got the work history, you've already paid your taxes to get Part A for no cost when you are eligible. Okay, you have to have 40 quarters, which is basically the equivalent of 10 years, similar to your Social Security credits that you need to earn for Social Security benefits. So most people will pay zero, but if you don't get it for free, then you can purchase it, although that is pretty cost prohibitive, but we can certainly provide some information on that if that's your situation. Medicare Part B, and A and B are your two main parts of original Medicare, right? So Part B is your outpatient services. This is going to be doctors' visits, preventative services. This is going to also include things like an outpatient surgery, or you might have a cataract surgery or a knee replacement. Those are Part B. You can have the emergency room. There are certain medications that are administered by a doctor that would be covered under Part B instead of your prescription coverage, things like chemotherapy. Okay, those are also covered under Part B, and durable medical equipment. This is a premium required part of Medicare. So and I apologize that this is this is very outdated. I am sorry. The base premium actually in 2022 is $170.10. Okay, so we will update that certainly as soon as this is done, but I must have grabbed an old copy. But anyway, the base premium this year is $170.10. That is set by the government, so that is set to likely increase year after year. We had a pretty big increase from 21 to 22, went up about 15%. Hopefully, we won't see that again anytime soon. But premium is required, and it does vary based on your income. So that's the base rate. But depending on your income, and they do look back 2 years as well, you may pay more. And again, this is part of where we can help walk you through it, understand what you're going to be paying. Do you have an opportunity to appeal that? If you've retired and your income has changed, things we'll walk through with you one-on-one and help you out with. Medicare Part C is Medicare Advantage. These are all-in-one plans. So that's basically C equals A plus B plus D. They include additional benefits, dental, vision, hearing. You might have transportation, gym memberships, over-the-counter allowances, things like that. These are all through the insurance companies. So whereas A and B comes from the government, you would then the other option is to get Part C, which is going to have all your benefits administered by the insurance company, and then premiums and costs vary greatly, by where you live. So a lot of these plans will be $0 additional on top of your Part B premium, but you may have a premium, and it's going to depend on where you live, and of course the benefits and the plan design are going to vary based on where you live as well. And then the last part of Medicare here is Medicare Part D. That's prescription drug coverage. So coverage for self-administered prescriptions. These are also from the insurance companies. So you'll either have a Part C plan, which includes Part D, or you'll be on original Medicare A and B and add a standalone Part D prescription plan. But again, either way you get it, it's going to be coming from the insurance companies. These also vary quite a bit, probably more so than the Advantage plans in terms of the premiums. They're all over the place. And then the benefits are different as well. There are certain baseline requirements that Medicare sets in terms of the deductibles and certain thresholds of spending that put you into the next tier of how you're going to be paying for your drugs. But ultimately, they are going to vary based off of where you live and ultimately your medications, right? We don't ever make a recommendation that here's a great drug plan for everyone, right? Because it may be great for some, but not for everyone. And so it's really important that we sit down with you and understand your prescription needs. If you'd like us to look at that with you, then we can figure out ultimately what plan is best for you, whether it's for April through December, October through December, or start in January through the end of the year, based on your specific prescription needs. So we can find the plan ultimately that's going to cover your drugs and hopefully at the lowest possible cost, okay? This IRMA adjustment, that means income related monthly adjustment amount. So I mentioned Part B, you may have your premium may vary based on your income. There's also an income adjustment on Part D. So if you are going to get hit with an increase on B, you'll also pay an increase on D. With prescription coverage, it's an adjustment on top of whatever your plan premium is. And then Medicare supplement, not technically a part of Medicare, but it's an important component that works with Medicare. This is a private secondary payer. You may have heard of it referred to as Medigap. And you must have parts A and B, because ultimately what Medicare supplement is going to do is going to fill the gaps in parts A and B. So if you go to the hospital on original Medicare with no Medigap plan, you're going to pay a deductible. That deductible this year is over $1,500. All right, a Medigap plan will cover that. All right, if you go to the doctor, you have a deductible of $233 this year, and then you pay 20% for everything else covered under Part B. All right, a Medigap plan will cover that 20%. All right, so it's going to help you to really close the gap, give you lower and predictable out-of-pocket spending. These are also offered to many of the same private insurance companies, and benefits are standardized, which is great. If you decide to go this route with your care or with your health insurance, then shopping for plans from one company to the next, if you've decided on which plan, medical benefits are the same, which is wonderful. So makes it easy to choose, and we can just find the right company for you and the right premium. All right, so this is what you came for ultimately, is about working past 65, right? So do I have to enroll in Medicare at 65 if I'm still working? So the short answer is no, you don't have to, but really it depends. And the primary factor that plays in here in terms of whether or not you're going to enroll in Medicare at 65 is the size of your employer, okay? So if your employer has under 20 employees, Medicare will be your primary payer of claims. So really, you must enroll in Medicare if that A and B, if that's the situation, okay? And you need to apply during your initial enrollment period, or it's possible you may face lifetime penalties. So the big thing here is you may like your employer coverage under 20, but Medicare sees themselves as primary if you are in that situation, meaning that insurance company offering you your employer benefits, they're under no obligation to be your primary payer. So they could say, sure, you can keep this insurance, but we're secondary and we'll pay 20%, let's say. Without Medicare, you're primary, you're paying 80%. Okay, so it's important to understand that even if you're allowed to keep that coverage through whether your employer says so or the insurance company, you may be liable as the primary payer. So ultimately, if you're under 20 employees, you have to go on Medicare. So for a lot of self-employed, I run into a lot of realtors, for instance, that have to ultimately go on to Medicare because you have a small group and it's you don't really have an option. Now for those over 20, Medicare becomes your secondary payer of claims. So you very well could go ahead and avoid enrolling, or delay enrollment, I should say, would be the better way to put that. So you can delay both parts A and B, and then you can enroll in those through a special enrollment period later on, whenever it is that you decide you want to get Medicare. And the nice thing about this is you're in the most flexible situation of all. You can enroll in Medicare anytime you're still employed with that group coverage, plus 8 months after it ends. So not that you'd want to give yourself a gap in that scenario, but there's a lot of flexibility in this scenario. A lot of folks will stay in their group coverage, although that's not a guarantee that you should. All right? And what we do, again, our services are no cost to you, and we're happy to do some of the work in comparing what Medicare is going to cost you and expose you to compared to what your employer coverage will cost and expose you to, because it's not just premiums, right? You may have a lower premium on your employer coverage, but your exposure, you might have a $10,000 deductible, right? Or out of pocket maximum. So it just, again, there's no right or wrong, but we're happy to look at that with you to help you make a determination. What most people will do is get Part A, but we're going to talk about those that should and those that shouldn't here momentarily. And to be eligible for a special enrollment period, your group coverage must be considered creditable for Medicare Parts B and D. So even though over 20 employees typically will mean it's creditable, we always recommend just double check with your HR, your benefits administrator, to confirm that you're good to stay on there as creditable coverage. So when can I enroll in Medicare? Well, there are 2 enrollment periods when you're working past 65. The first is initial enrollment. That's going to be when you're turning 65. Special enrollment will be once you're beyond 65 here. So let's look at the differences. Your initial enrollment period is a 7-month window surrounding your birth month, your 65th birth month, okay? So 3 months before, let's say you're born on April 16th, it just happens to be my birthday, so how about that? It's coming up here soon. 3 months before your birthday, if you do apply, then coverage will start on April 1st. Let's say if your birthday is the 16th. So it's not like it starts on your 65th birthday. It will start on the 1st of the month that you turn 65. Or if you're born on the 1st, it can start the first of the month prior. So you have those 3 months before, the month you turn 65, and the 3 months following. Just understand that once you get past your birth month and you use those 3 months after your 65th birthday, you will start to see delays in when that Medicare starts. So instead of it starting in the following month, you can see delays of 2 to 3 months if you apply in months 4, 5, or 6, or it says 5, 6, or 7. And this is when you can enroll in all parts of Medicare A, B, C, and D. A special enrollment period would be ideal for those of you who are here to learn about working past 65. You have an 8-month period after you stop working or your employer coverage ends to enroll in parts A and B. By the way, you can also do this anytime you're still employed. So it's really, it makes it pretty simple to prepare. I mean, obviously there's a lot that goes into it, but you have a long time to prepare. So that's what we say, it's never too early. You might be 2 years away from retirement. You're trying to figure this out. Look, this is good information to know what you can do. We're happy to talk to you at any point in time to help you prepare for it so that when you get to about 90 days out from retirement, we can get the Medicare enrollment process started, get the insurance situated, and you're all good to go months before you have to make that transition so that the day your employer coverage ends, Medicare will begin, and you never have any lapse in coverage or risk for penalties. You also can enroll in Part C and D after your coverage 63 days after that coverage ends. So A and B is a little different. You get that 8-month period. C and D, you can enroll only for those 63 days following the end of the coverage. So it's important, you may have this 8-month window, but we don't recommend using it because then you might lose the opportunity for Part C or D. Medigap is also included in here because Medigap, again, is going to be your secondary payer to A and B. So we recommend getting that at the same time. Now, Medicare and health savings accounts. So I mentioned earlier, many people are going to apply for Part A or enroll in Part A when they're 65, even though you're still working. Not everyone, okay? So it's nice to have Part A because you're not paying for it and it's secondary hospital covered. That's great, okay? You get extra insurance, you're not paying anything for it. Wonderful. However, if you're contributing to a health savings account and that is your priority, you want to continue funding that HSA, it is important that you understand you cannot have Medicare and fund your HSA. Okay, so it's important you stop it, and you need to stop it if you work past 65. Okay, and let's say you're 66, you really need to enroll. So you really need to stop your HSA contributions 6 months before you actually want to go on Medicare, because Medicare Part A is going to start retroactively up to 6 months prior. So like I said, if you're 66, it's going to start back to when you're 65 and a half. And if you have HSA contributions during that time, those are going to result in excise taxes and a big headache you don't want. So it's not just about stopping the HSA contributions when you retire. You actually need to plan ahead because Part A has a retroactive start date. I got a question here that I'll address now. What about an FSA? That is not the same. So if you have a flex spending account, that same rule does not apply. You can certainly fund that. So we're talking specifically about health savings accounts. These are tax deferred accounts, tax advantage accounts. So they obviously have there's a great benefit to them, but you can't have both that and Medicare. Now you can use those funds for Medicare expenses. You can use them for everything except your Medicare supplement premium. So Medicare Part B premium, Medicare Part D premium, copays, coinsurance, drug copays, right? So it's great to have those funds and you can use them when you go on Medicare. You just cannot fund the HSA. But let's say your spouse is not going to be on Medicare yet, then your spouse can continue to fund the HSA. If it's your spouse's insurance and you want to fund the HSA when they go on Medicare, you can do that. So it's just about the individual who is on Medicare cannot fund their HSA. Now, COBRA cannot be primary after age 65, regardless of who pays for it, even if you're paying for it or your employer is paying for it. So this gets tricky too. And I'm actually working with somebody specifically who had COBRA for a while. They got a nice deal after retirement where COBRA was being partially subsidized, and that's great. I mean, they had good insurance, and COBRA ultimately is just a continuation of your current coverage from the employer, but a lot of times you're paying the premiums. But even if the employer is paying for it, it doesn't matter. So as soon as you become 65, if you're on COBRA, it's going to be secondary. So you need to get onto Medicare. What will ultimately happen is that if you wind up on Cobra, first of all, your primary payer, if you don't have Medicare, that's going to be a problem. Okay. Cobra is a really expensive secondary insurance, by the way, if you're not getting it subsidized. So I wouldn't recommend that if you can help it. But it's just you're going to be responsible as primary payer. Plus, you'll have late enrollment penalties potentially. So it's not going to be seen as creditable coverage, which then ultimately, if you try to keep Cobra for the 18 months you're allowed to have it, assuming you have coverage, even if it's subsidized by the employer, you're going to wind up being subject to late enrollment penalties, and you'll only be able to apply during the general enrollment period, because termination of Cobra is not considered a special enrollment period. So instead of being able to apply for Medicare and start at the month after Cobra ends, you have to wait for general enrollment, which is every year from January 1st to March 31st and doesn't start until July 1st. So that can become a huge mess of lapses in coverage and penalties and paying too much in premium. So it's important that if you have a Cobra situation, you turn 65, we navigate that properly. Again, this is all stuff that we do with you one-on-one. So this is not about, learning what you're hearing here today, and then, have to remember everything and figure it out all on your own after that. So final thoughts, because I have kept you here now for 20 minutes and I told you I'd have you out quickly. It's never too early to start. So even if you're a year out from 65 or a year out from retirement, there's, or more, it's good to get this information in your hands. So we always, recommend reaching out, and we're happy to answer questions. I don't care how far out you are from this point in time. It's important to know what your options are, because it ultimately is part of all your retirement planning. Do your research. So again, part of our value, okay, as your broker, is to do a lot of research for you and do a lot of work on your behalf to determine what your options are, what your needs are, find plans that really meet what your goals are. But you should always do your own research, okay, and inspect what you expect out of us. And so we always recommend you do that. Start that research early, understand your options, and ask questions. So again, part of what we do in our educational process is, what are your options? Like, what are your options for enrollment when you're working past 65, or what are your options when you actually decide to go on Medicare between original Medicare and Medicare Advantage, right? I'll do a webinar on that again in April if you're wondering the difference between those two. Of course, we'll discuss that with you one-on-one, but you have to understand your options when you go into Medicare. That will help to narrow down your plan options. And then ask questions. I say this, and it's cliche, but there are no dumb questions in Medicare. I hear this every week, almost verbatim, is that I'm educated or I'm an intelligent person and I just can't figure this out, or can't wrap my head around all this. That's normal. Don't feel bad. And there are no dumb questions truly when it comes to Medicare. So with that said, I'm going to see if we have any questions. I did already answer one about the FSA. So I have a question about about Medicare Supplement and Medicare Advantage. So which one is better? That's something that I can't really answer, because it depends on you as the individual, what your needs are and your wants, what your risk tolerance, right? One of those options is going to be more flexible in terms of who you can see, higher fixed cost up front, but lower potentially and more predictable on the back end in terms of out of pocket. The other option is going to be more benefit rich, lower cost up front. Pay as you go, higher exposure, potentially higher risk. So there's no right or wrong there, but that's part of what we discuss with you, try to help you figure that out when the time comes. But that's a very good question. And what do I do if I'm working past 65 and my spouse or if I'm turning 65 and I want to retire but my spouse is not 65 yet? That's a tough scenario, right? There is no drawing Medicare off of your spouse before 65. Okay. So you may very well, apologize, let's get another question. I'll answer that here in a second. So you may very well have a spouse who qualifies to draw Medicare when they turn 65 off of your work record. And okay, that's possible, but you still can't get it before 65. So a lot of times you might run into a situation where, the wife's turned 65 and the husband is 62. What do you do? Well, your options are either you keep working to keep that employer coverage for your spouse, or you don't work and you go on Medicare yourself, and then your spouse is going to have to buy an individual plan, right? And that could be through a health insurance broker. We don't do anything under 65. We really are focused on this particular niche. It's got enough need and enough questions to help people out. But you could talk to somebody or go to healthcare.gov. You have to pretty much purchase that coverage individually, which is expensive, unfortunately, but that is currently the landscape. So it's a tough situation. Certainly it can get expensive, but hopefully it's relatively temporary for a few years. And then, the other significant other can get on Medicare. So question, I missed the first session. So you think, Justine, you're talking about Wednesday. I did a session on Wednesday about Medicare Advantage versus original Medicare. So I will do that again on, I believe it's April 20th. That one's always typically the third Wednesday of the month. So in April, that would be the 20th. So the 20th at 10 a.m., I believe, and I can send you the confirmation or registration link, but I'll be doing a session on Medicare versus Medicare Advantage. By the way, I do all these things one-on-one all the time with everyone. So, I know this, it's efficient to go through and present to a group, but, ultimately our relationship with you is a one-on-one relationship. Okay. I am your broker. I'm available to you and I work with you directly. So, those are the kind of things that we do focus on in our one-on-one conversations, is helping you determine the differences, pros and cons between both original Medicare and Medicare Advantage. And you are very welcome. So that's all I have for questions so far. I'm just going to check. I was live over here. Oh, here's one. I'm turning 65 in January. When should I start the process? So if you go back to the slide about the enrollment periods, okay, whoops, then this is whatever. This is not working very well. So 3 months prior. Okay. So if you turn 65 in January, let's say from January 2nd to the 31st, not on January 1st, I'll cover that in a sec. If you're turning 65 in January, you want to start your enrollment into Medicare as early as October 1st. Now, if you're born on January 1st, you can do that on September 1st. I do want to state that if you're taking Social Security at 65, Atif, thanks for coming. Appreciate it. If you're taking Social Security before you turn 65, you will be automatically enrolled in Medicare. So that will happen, again, typically around the 3-month mark prior to your birth month. It doesn't start any earlier. So you're turning 65 in January and you enroll in October, it will start January 1st. But good question. And I always recommend, especially these days, when you're enrolling in Medicare, it's about a 90-day window we want you to start. And again, we do this with you. So we will literally help you sit there and enroll in parts A and B if you need help with that. And whether that's at 65 or when you're working, and we really want to do that at the earliest possible point, which is about 90 days, because it will take several weeks sometimes. And I've heard of, unfortunately, taking a couple of months this day and age with Social Security to get you your Medicare card and process all that. And then you're dealing with narrow windows to place your supplemental insurance. And again, we're prepared to do that for you quickly. It's an easy process once you get your Medicare card. But there's no one wants to feel stressed out in this situation. So 90 days is the best time to start, 90 days ahead of your birth month or your retirement month to start the enrollment process. So that's all I have for questions. So I'm going to go ahead. I'll stay on here for a couple minutes. I'm just going to mute myself. If there are any further, muted myself a little early. If you have any more questions, send them my way. Otherwise, reach out if you want to meet one-on-one, and please feel free to come by and join the webinars in April. All right, thank you so much. Everyone have a great Saturday. If you're like anywhere near me, I'm in Northern Virginia. Weather's beautiful, so hopefully y'all are getting some nice spring weather and you can enjoy the outdoors today. Take care.